Welcome to the Avexia webinar series, Introduction to Micronutrient Testing. My name is Joanne Iverson. I am the Director of Client Relations for Avexia Diagnostics. Let me introduce Dr. Wayne Sodano, Director of Clinical Support and Education for Avexia Diagnostics. I will now turn the webinar over to Dr. Sodano.
Okay, thank you so much, Joanne. So here are the learning objectives for this webinar. First, why test micronutrients? I'll be reviewing that. Next, I'll be reviewing the science and technology of the micronutrient test. Then I'm going to show you a sample report so you know how to interpret it. And finally, I'm going to show you how the micronutrient test has a positive impact on your practice. So you get positive outcomes, and that's what this is all about here. So first objective, why micronutrient tests? So let's explore that. First, you see a pie graph here, and you see 19%, 38%, and then 43%. So what does that mean on the pie graph? First of all, 19% are subjects that were looked at for intracellular micronutrient levels. These subjects showed no deficiencies when they were looking at the intracellular levels of the micronutrients. Next, if you look at on the green, the 38%, what that was multiple deficiencies without supplementation. Interestingly enough, 43% of individuals that took supplementation had deficiencies based on the intracellular micronutrient levels. So I have a question on the bottom, is what's going on here? Why are individuals that take supplementation tend to have more deficiencies based on this type of testing? So let's talk about it here. First of all, this is looking at the intracellular micronutrient deficiencies. Why is that important? Micronutrients are involved in the biochemical reactions inside the cell. They've got to get in the cell for cellular metabolism, for energy production. All that happens inside the cell. They're not of great value to the cell if they don't get in. So that's why this test is extremely important. Now, this particular test has been used for more than 20 years, and it revolves around micronutrients getting into the cell for proper biochemical reactions to take place. And that's what's going to promote cellular health. If you have cellular health, you have health of the organs, and then you have health of the whole body. And that's what's important. Here's a list of some analytes that are tested for, and I'll show you a complete list a little bit later on. You can see B1, B2, B12, folate, calcium, zinc, magnesium, glutathione, which is the antioxidant, vitamin E, lipoic acid, another antioxidant, selenium is needed for thyroid, it's needed for antioxidant, vitamin D for the immune system. So you're going to get a really, really good look at that. The bottom line here is that these micronutrients need to get into the cell for the biochemical reactions. If they're not getting in the cell, then the cell's not working properly. This is where this can be somewhat superior to just looking at the serum levels. So on this slide shows you factors affecting nutrient status. And you can see dietary intake. There could be absorption problems, gastrointestinal problems, problem with transport, liver problems. All of these things listed are disease. There's lifestyle factors. Pharmaceuticals can interfere, and I'll show you a slide on drug-induced nutrient depletion that you need to account for. The one I have highlighted in red is the cell membrane composition. Here's the deal with that. The cell membrane, of course, you know, it surrounds the cell. It allows for things to get in and get out. If that composition of the cell membrane is not in working order, because it's made of phospholipids, it has proteins in it, it has glycolipids in it, it has cholesterol in it in specific amounts, and essential fatty acids. A good example is years ago, a lot of trans fats were used in margarine and so forth, would clog up the cell membrane. That would cause a decrease in absorption of nutrients into the cell. The receptors weren't working properly. You need the receptors to get glucose into the cell properly, which can cause hyperglycemia. So the SpectraCell, the neat thing about this test is that the SpectraCell test provides information on fatty acids, particularly oleic acid. So you get a good look at cell micronutrients as well as some fatty acids as well. So very powerful. This is the slide that I mentioned just a slide or two ago about medication and nutrient deficiencies. It's also known as drug-induced nutrient depletion. As you can see, antidepressants, anti-inflammatories, statin drugs, hormone replacement therapy, all can cause depletion of specific nutrients. The bottom line with this slide is that you need to account for that. So it's a good idea to have a reference book if your patients are taking certain medications and realize you have to factor that in when you get this particular test. because it's well known that statins are going to deplete coenzyme Q10, but you can see here it also depletes vitamin B12, vitamin D, vitamin E, folate, and also vitamin A. And you can have, and by the way, you can have access to these slides. Please download these slides. There's a lot of good information on this deck as well. So what I want to do is I want to review the technology and give you an idea of how they're able to look at the intracellular nutrients on this particular test. So let's go ahead and do that. Now, the micronutrient test, it uses peripheral lymphocytes instead of serum to assess for over 30 micronutrients. So that's important. Looking at the lymphocyte, it's going to reflect the cell's nutrient status over the past 4 to 8 months. So that's what's going on. It's not short term, it's long term. So essentially, how micronutrients and also antioxidants are functioning in the lymphocytes. What that means is that this test looks at the metabolic function as opposed to isolated biochemical pathways. So that is a powerful test. That's what they're doing. Now, with the lymphocyte, you see here what this is a staining of a lymphocyte. The arrow is pointing to that. So this test is going to provide a more accurate measurement of long-term functional nutrition. You're not just getting a snapshot of nutrition as you would with serum. So you definitely want to keep that in mind. Again, that's the power of the test. So again, the T lymphocytes, they live in the body for anywhere from 3 to 6 months. Some say 4 to 8 months. You want to know what's going on inside the cell. That's what this test is providing. It looks at the cellular biochemistry, not just what the serum shows. So that's important. What they do is they harvest the lymphocytes, or they isolate them, then they incubate them, and I'll show you on another slide. And then they assess them for a growth response, which is then measured. So you get an idea of the function, how the lymphocyte is actually functioning, and what are the contents of the micronutrients in the cell. So very unique test. I want to give you an example here. Let's look at how magnesium is checked, or the nutriture of magnesium. Now, magnesium is involved in over 300 metabolic reactions in the body. You all probably know that magnesium is required for energy production, meaning ATP. It's needed for the synthesis of nucleic acids and proteins. It's needed for carbohydrate and lipid metabolism. And you probably remember way back when that magnesium is needed for that delta-6 desaturase enzyme, which is part of the metabolism of essential fatty acids. It's extremely important. Magnesium is also needed for methylation, for sulfur amino acid metabolism, and for the production of glutathione, not to mention detoxification. So it gives you a really good window into that. And as you can read on the slide, less than 1% of the total body magnesium is present in the blood. Most of it is intracellular, and that's what you want to take a look at, to look at the nutriture of the cell of magnesium, inside the cell. So that's the power of this. So let's take a look again at this lymphocytic, that's a tongue twister, magnesium. Decreased intralymphocytic magnesium is associated with diastolic heart dysfunction in patients with essential hypertension. That's what was analyzed. Next, serum magnesium is generally considered an unreliable indicator of magnesium nutritional status or nutriture, and now you know why, because magnesium, most of it lives inside the cell. So that's what you're going to get a window into looking at of what's going on with the magnesium levels. Now, the SpectraCell test also looks at ascorbic acid, which is vitamin C, and plasma or serum ascorbic acid. That reflects recent intake of the nutrient rather than the body stores. This is going to give you a look at what's going on inside the cell. Now, leukocyte content reflects the amount of ascorbic acid. They put AA on there, by the way, but in this case it's for ascorbic acid, available for storage, what's going on inside the cell. So the measuring of leukocyte ascorbic acid contents is a valuable tool, again, for assessing the patient's nutriture. If you're looking at serum vitamin C, which really isn't done because vitamin C has a very short half-life, this will give you an idea of what's going on inside the cell. We really don't have the technology to look at serum vitamin C because of its short half-life. You get an idea of what's going on with looking at it intracellularly. Again, a powerful tool. So here's a summary of the technology. So the blood is drawn, you do what you got to do, you send it back to the laboratory. All the instructions are there. It's really good. Here's day 1 through day 5. This is what's done at the left. So on day 1, they're going to isolate the lymphocytes from the blood. They're going to incubate them and grow them in a defined culture medium. Day 2, what they're going to do is they're going to put this, what's known as a mitogen stimulation, which is essentially a growth factor. It's certain proteins have that ability to start to cause proliferation of the lymphocytes, to see how they grow, see how they're reacting. Then it's going to be tagged with a radioactive thymidine incorporation, and then they're going to look for a growth response. That's going to show long-term nutritional markers. So as you see over on the right, there's this patented technology. There's over 200 growth mediums. There's various components of growth depending on the intracellular levels, and then they will assess on day 4 for deficiencies, transport, and metabolic requirements, and then give you a long-term assessment of the nutritional status of this of the individual, the blood that you went ahead and sent in. So what analytes are included in this test? So here they are. So it's a comprehensive nutritional panel. You see all the vitamins. You got vitamin A, B vitamins, B1, B2, B3, B6, B12. There's vitamin C, like I mentioned, vitamin D, vitamin K, biotin, folate, vitamin B5, by the way, is pantothenic acid. The minerals, you got calcium, magnesium, zinc, copper, manganese, and chromium. Amino acids are checked for, asparagine, glutamine, and serine. And there's reasons for that. Antioxidants. Got a good look at what's going on with alpha lipoic acid, coenzyme Q10, cysteine, glutathione, selenium, which is also needed for thyroid. Remember that as far as being an antioxidant, it's needed for glutathione recycling. Vitamin E. There's carbohydrate metabolism. It looks at fructose sensitivity and a interaction between glucose and insulin. And by the way, when you're looking at that as well, remember chromium could fall under that as well, because we need that for insulin, for the receptor chromium, for the insulin receptor for glucose to the cell to open up and get glucose into the cell. Here's a list of some fatty acid, particularly oleic acid, that's omega-9. Some metabolites, looking at choline, inositol, carnitine, which is needed for fatty acid metabolism through beta oxidation. This test also looks at 2 other particular broad spectrum analytes here, and you see the Spectrox. What that is doing, and I'll go over that on another slide here, but essentially it gives you an idea of what is the total antioxidant function of that individual. It gives you a percentage of that. Next, it has unique to this test is an immunodex, and that gives you what is going on with the immune system. It gives you an immune system response score. Is the lymphocyte up for the challenge of a pathogen, as an example, or to protect the body? And I'll go over that in detail coming up, so hang in there on that one. So here is a micronutrient test. This is a sample report. So obviously on the first page, you're going to get the patient's name, you're going to get the specimen and who you are. So that would be page 1. Page 2 on the report, it's good to show your patient this as well, because it says here, we measure the functional level and capacity of the nutrients present in the white blood cells where metabolism takes place and where micronutrients do their job, just like I had said. And next, for long term, this test measures intracellular micronutrient function over a period of 4 to 6 months. That's beyond the static serum testing. So very, very important. So next, what we measure, it said we measure over 31 micronutrients. So you can explain that to your patient or client, from vitamins to minerals, fatty acids, metabolites. It looks at overall antioxidant function and immune function, and it's going to give you a tool for treatment and also treatment recommendations. So that's on the first page. Those 2 are combined. Next, on that page as well, you're going to see what's the results at a glance. Not only is it going to look for the abnormal micronutrient levels where they're definitely deficient, it's going to give you an idea of borderline micronutrients, because these are mated up, paired up. So you can really get an idea of a broad spectrum of what is going on with the individual. And I'm going to show you that later on, looking at specific conditions on why it's good to look at certainly the functional deficiencies, but also combining those borderline deficiencies. Because generally, if someone has one deficiency, they're going to have others, and there may be certain reasons for that, and also indicate certain conditions are associated with that as well. So it'll be a lot of fun to take a look at that. Now, these are the 2 specific assessments that the SpectraCell test does. It does this Spectrox and the Immunodex. So let's talk about the Spectrox first. The Spectrox gives you an overall antioxidant function of the lymphocytes, and it gives you a percentage of the total antioxidant measurement, not just looking at two specific values. It looks at a broad spectrum of those and says what is going on with the antioxidant level of this particular person, and of course it measures it in, like I said, in percentages. So it measures the ability of the cell to withstand attack from free radicals. You can look at it that way, or other oxidative stresses. It gives you an idea of the antioxidant reserve. So essentially, it allows for early intervention to correct the deficiencies and promote health and play a role in prevention and clinical treatment of a variety of conditions. If you're low on antioxidants, it's going to cause damage. Think of it this way. It's going to cause internal rust as a metaphor. So you can look at it that way. Next is this Immunodex. Now that gives you the total immune function. So what is that telling you? That's an indicator of the patient's T lymphocyte proliferation, or meaning growth. So essentially, the Immunodex is an indication of how well the person's T lymphocytes are functioning by measuring their growth response. Remember, they added that particular protein or the mitogen to see how the cell is growing. Is it responding properly? Essentially, this is a marker of immune function. You can use it as a biomarker. You can go back when you redo this test or recheck. And by the way, you're probably going to have to wait for maybe 4 months or 6 months later, because remember that this test looks at 4 to 6 to 8 months, somewhere in that ballpark. So that's when you would want to retest it, take a look at the Immunodex, Spectrox, and see if you've fixed the problem, addressed the cell membrane, got the nutrients back into the cell. But these can be used certainly as wonderful biomarkers, the total antioxidant function and the total immune function. So please keep that in mind. This is just showing you on the report, looking at the B vitamins and amino acids and metabolites. Just up top here, well, here's how you would read this, and they have other bar graphs as well for, I think, which is much easier reading, but you can take a look at this one first. As you see on the top, here's vitamin B1, and what is expected is over 78% in that particular person's cell, and as you can see, they only picked up 73%, so it's flagged deficient. Here, borderline, there should be over for B2, there should be over 53%. There is over 53, but it's getting real close to 53 at 56, so they label that as borderline. So that's how this is read. Here are other analytes that I showed you, the vitamin D, vitamin A, and I think you got the idea on how to read this particular graph. Carbohydrate metabolism, here you see chromium in here as well. Here's all your antioxidants, the whole list. That's where they get that Spectrox from, looking at the antioxidants, what's going on with this individual. Look at glutathione, coenzyme Q10, selenium, vitamin E, alpha lipoic acid, vitamin C, and also cysteine, which is needed for the production of glutathione. So here, I like these bar graphs kind of a whole lot better, but because you're able to analyze them and look at them as a package. You can see what's going on with the B vitamins, the amino acid metabolites, other vitamins and minerals, all like at one picture, and you can analyze from one over the other. This will be clear when I show you conditions later on in the webinar. So here, as you can see, anything down in this area, in the gray area, is deficient. The yellow area is borderline. Green means everything is pretty much good to go. So you can do an analysis and say, what's going on? Why is B1 low, B3 low, B2 borderline? What's going on here? What's going on with glutamine? Here is oleic acid, the omega-9, that is part of the cell membrane. If this thing is actually borderline here, maybe things are not getting in the cell properly because that cell membrane isn't really happy or doesn't have the right amount, right composition, right amount of phospholipids in and cholesterol, protein, glycoprotein in it. So that we would question that as well. So a really good look at this. Again, just so you get an idea, because the technology can be, what they're using can be a little bit daunting, but I just wanted to review it one final time so you can really get an understanding of what's happening here. So first, the blood's drawn, sent to the lab. There's an isolation of the lymphocytes to purify. They're washed, and they're counted, and they're plated, as it says there. Day 2, incubation. The cells are incubated for about 5 days. They have a culture in a medium that they put it into, containing it at optimal levels of essential nutrients to sustain their growth. So then they label them with radioactive thymidine. I don't know why I have trouble saying that word, but I do for a moment. And again, mitogen means a growth factor. Then they harvest the cell and they count them, and then they process this data. data that you just saw on the patient history report or the end report. That's how this works out. I believe this is the only lab I know that does look at intracellular nutrients that I know of, and SpectraCell's one. Again, they've been around for 20 years, so they've been doing this a very, very long history, apparently very successful history. I want to show you on this slide and the next slide, just to refresh your memory about energy production. This is fats, carbohydrates, and protein. Again, those are the macronutrients. Macronutrients mean to be converted to, or need to use the micronutrients to process, to do what? To create energy at the bottom, the ATP. So if you look at straight up here, this is carbohydrates. It'll go through glycolysis, then it'll create pyruvate. Pyruvate will go to acetyl-CoA. You also see fats need to be metabolized. They need carnosine, vitamin E, alpha lipoic acid. You see where all these nutrients or the micronutrients are needed to actually create acetyl-CoA, which then goes into the Krebs cycle or citric acid cycle, which then all of that is needed to go into, and this happens in the mitochondria, to create ATP, energy, because without energy, it's not going to be able to sustain life. The point of this slide is notice of the nutrients that are needed to drive these reactions as well. There's coenzyme Q10, B12, all of this is needed. And this gives you a window, and also on the report you can see of what's going on. If somebody has fibromyalgia, this system may not be working properly. Again, chronic fatigue, so forth. So that was the point of showing you this slide. Also, keep in mind, you'll have a window into looking at methylation. Methylation is needed for detoxification, for cell adaptability. It's needed for gene regulation. It's needed to produce and repair DNA. It's also needed for methylation of DNA, the methylome of the DNA. It's needed for that. This shows you the cycles, and this shows you the nutrients that are needed. When you get your report back, you can say, that's why this may not be working properly. It can also look at the methylene tetrahydrofolate reductase. You can get an idea, hey, do I need to do a genetic testing? This area is not working properly. Things are not being processed properly. So it can give you a window into that as well. So very powerful test. Also, when you get the report back, it's going to give you information on the deficiencies. It'll give you information about, refresh your memory on the physiological function, in this case, chromium. What happened in a deficiency? What's going on? So we're going to educate you and also your patient, because sometimes we don't have all the stuff in our brain and we need little refreshers. I'm constantly looking up stuff in reference books, and a lot of times I don't have all the stuff jammed in there. But this is going to give you information on cellular function, performance, not just potential. Also, on the bottom part of that page, this is still chromium. It's going to give you some food sources, so you can use this and tell your patient, look, here's some foods that you can take that are high, say in this case in chromium, to help out. It's give you information on repletion information. Like in this case, it's saying that you don't want to avoid taking more than 200 micrograms of chromium per day, so you might want to do a little bit less than that. You definitely want to incorporate some foods. Hopefully there's a good absorption of the gastrointestinal tract as well. So it really is a helpful tool on looking at the deficiencies, and when it shows these particular ones on the back that are deficient, and it gives you that information again on the physiology, on deficiencies, what things would appear to be like as far as signs and symptoms, food sources, and also information on repletion, how you would want to supplement. So great information. Now this slide, definitely download these slides. Please do that, because this is just packed with information on looking at an analysis of certain conditions, on how the micronutrient deficiency patterns are common for these conditions. And I have them outlined for you. So essentially all of these conditions, inflammation, hypothyroidism, depression, headaches, autism, have been outlined. So I'm going to briefly go over each one of the slides. I'm not going to read them all in detail, because there's about over 20 slides, but I want to give you an idea of how powerful this information is and how you can extrapolate it into looking at the particular condition that essentially shows up in our office on a regular basis, a chronic illness. So please download a copy of these slides and use them as a reference. Very important. So let's go to the first one here. So this is ADHD, as you can see on the slide. These are the associated micronutrient depletions. If you look over on the left, choline as an example, and it gives you some great information. Choline is the precursor to the neurotransmitter acetylcholine, and that regulates memory and focus and muscle control. And that may be low on the individual. Magnesium as well. It's linked to deficiency and neurotransmitters. But the main thing that and you can read these as we go through the slides, just pointing out a few things to you on these particular conditions. The point is, when you look at these, always ask yourself the question, why and how did these micronutrients become deficient? Is it poor diet? Gastrointestinal problems going on with the individual? Question that. You may need to do further testing as a stool analysis. Find out what the diet is, doing a diet history. If it's ADHD, you may need to ask parents if they're children. So there's wonderful information on these slides, like I said. So here's anxiety. Once again, choline is needed, precursor acetylcholine that can affect mood. Low levels are linked to anxiety, and great information. Vitamin B6, you see on the left side, cofactor for synthesis for the calming neurotransmitter gamma aminobutyric acid is needed for serotonin and dopamine, the reward center. So great information. Autism, very similar. Conditions are low. B12, by the way, low B12 impairs detoxification. That can cause neurological damage responsible, or at least adding to that. That's always something to look for, and I have found that with children with a pervasive developmental disorder. Keep that in mind. And they also tend to be low on antioxidants, and you have the list here, so it can really help you focus when you get the test back to help these individuals. Asthma, here's the pattern. Asthma, magnesium, by the way, tends to be low because intracellular magnesium levels have been linked to asthma severity. So you really need to take a look at that. If an individual comes in, if you're looking to look at their literature, you know, chronic asthma, take a look at these things. Aside from checking out environmental toxins and other causes, allergies, food allergies, gastrointestinal problems, we know that they're all related. Diabetic, here are the analytes that are off on your SpectraCell test with diabetes. Very common: zinc, magnesium. So you definitely want to take a look at these. Depression, very similar, you know, to anxiety as far as micronutrients are concerned. This can give you a hone in on what micronutrients tend to be low with a patient with depression. You can also do you can have them do oh my gosh, I can't think of it right now, that they can fill out a form, a depression scale, to take a look at it, a survey. A good idea to do that as well if you're seeing a lot of patients with depression. And go ahead and do this type of test. Another test you deem necessary. This can be really helpful. You need to look at the micronutrients intracellular. It's very helpful. Dyslipidemia, again, here are the analytes you would take a look at. Estrogen metabolism and hormonal imbalance, very important. Vitamin A, all these are important for metabolism of estrogen, for breakdown, buildup, and so forth. All this can be off. If there is reproductive hormone imbalance, certainly you need to look at other avenues, detoxification, and so forth, but you need to look at the micronutrients. Micronutrients are needed. They drive detoxification, also to create the steroidal hormonal pathways that you should be familiar with. Fatigue, I mentioned that before. Certain things that are associated with fatigue, the micronutrients. So here they are for you to take a look at. Once again, download these slides, very powerful. Gastrointestinal health. I want to pause there just for a minute. Yeah, you can do a stool analysis. Absolutely, 100% do a stool analysis. Take a look at, you know, get rid of the pathogens, restore the health of the tract, repopulate with the good bacteria. You want to do all of that, get the digestion working properly. But remember, the enterocytes, the cells, they need health. They need these micronutrients to keep them healthy. Isn't it a good idea to take a look at micronutrient levels for the cells themselves, for the colonocytes, the enterocytes? They're needed. So this gives you that extra feature to make sure that those cells are healthy, their cellular function. That's where this comes into play. So it's kind of a 1-2 combination, in my opinion. You can take a look at both. So hopefully that makes sense to you. Male, female, fertility, things that are associated with that, deficiencies, and take a look at that. Male deficiency or male infertility, excuse me, fertility or infertility. And infertility, I know in males associated with zinc deficiency, selenium, antioxidant levels. So if you have a patient that wants to assess fertility, you can look at from a nutritional perspective. Please do this test. It can give you much very important, excuse me, information. Fibromyalgia, I already talked about that. That's all in that chronic fatigue thing. So you can look at that. Headaches. How many patients are coming in your office with headaches? Magnesium is a superstar. I think we know that, particularly for migraines. You really want to take a look at intracellular magnesium levels and get an idea what is a NutriSure. You want to look at energy levels, mitochondrial levels, extremely important for migraine prevention. So you would look at coenzyme Q10, very important. What a wonderful window to take a look at that to restore cellular health and help with these conditions while you're doing other treatments as well. Hypothyroidism. The thyroid is when the thyroid gland is producing thyroid hormone, it needs oxidation. As a matter of fact, it uses hydrogen peroxide in the enzymatic reaction. So you want to make sure that the gland has enough antioxidants in it. The body has enough antioxidants to sequester that oxidative stress in the gland. And this gives you an idea also other nutrients that are needed for the thyroid as well. Certainly selenium, I'm sure you're aware of that, and zinc is needed. Hypertension, across the board here, just about everything, as you can see, but you can look at the pattern of when you get your test back, and you can look at these. That's where that bar graph is extremely helpful. And you see, boy, that really associates with hypertension, all those deficiencies. You can put a pattern together and say, that's what makes sense. And by your changing the diet, working on the foundational things for the patients that I know you all know to do, detoxification, changing the diet, stress reduction, exercise, and so forth, restoring the micronutrient levels, extremely important to help with this condition and all conditions. Inflammation, here's a list of analytes that are deficient. Insomnia, here's methylation. Again, I mentioned before, it'll give you an idea of what's going on with methylation. It may prompt you to do a genetic test for the methylene tetrahydrofolate reductase, SNP, if things are off, so it can give you a clue for that as well. Pain syndromes, by the way, up top here, very important to have the right amount of essential fatty acids. Remember, fatty acids will get converted in the body to the eicosanoids, anti-inflammatory and pro-inflammatory. Oleic acid, by the way, as it says on the slide, is a fatty acid. It's a precursor to what's known as oleamide, and that is it has an analgesic effects on the neurotransmitters. It helps with dopamine, serotonin, acetylcholine, and gamma-aminobutyric acid, all of which play a role in pain signaling. So that's a real good one to take a look at for chronic pain, and how many patients are coming in chronic pain. Another reason to take a look at that as well. Sleep apnea, the analytes here for you to take a look at that are associated with that are very commonly sports nutrition as well. Telomeres, they are on the end of the DNA, and when they start to shorten, it means it could be shortening of cell lifetime. So I won't get into the genetics of that right now, but this test can take a look at. These are associated with a shortening of the telomeres, or essentially a shortening of the cell life. Calcium will be low, manganese, vitamin D, vitamin E, vitamin C, glutathione, of course, antioxidants will be low. So it'll take a look at that as well. Testosterone levels, these are associated with low testosterone levels. And weight management, right here, these are all associated with weight management and problems with obesity, and we know that's a big concern, especially in the United States. So hopefully you have a good idea of how to use this test, how to look on the sample report of what's going on, and if you have any questions, certainly you can contact us. I'm going to turn this over to the Joanne, if she's still there, hopefully.
I am. Thanks so much, Dr. Sodano. How to order the micronutrient test. Step 1, log into your Vexia account. Under the test menu, you will see under step 2 a section for SpectraCell laboratories. You can just click on the laboratory icon for SpectraCell. You will be able to enter how many kits that you will need, enter the information, and just go to the end and order the test kits. Ask the Doctor is a free service available to all of Avexia Diagnostics clients, accessed via your Avexia clinical portal. Dr. Wayne Sodano, Director of Clinical Support and Education, will review test results, clinical conditions, further test recommendations, or answer any other questions you may have via email for the SpectraCell test, the micronutrient test, as well as any of our other tests. In addition, our clients have the option of scheduling either a telephone or a video conference for a fee. And lastly, here are all the ways that you can reach us at Avexia Diagnostics. You can find more information at avexiadiagnostics.com. Our telephone number, 888-852-2723. Always, you can email us at info@avexiadiagnostics.com. Live chat is also available. We are here Monday through Friday, 8 a.m. to 8 p.m. Eastern Standard Time. And thank you all for joining us today in this Avexia webinar series, Introduction to Micronutrient Testing. Thank you very much. Bye-bye.